briefing. We have Dr. Chong Shuk Kwan from the Center for Health Protection, Mr. Tony Wong, Deputy Government Chief Information Officer, and Dr. Larry Lee, Chief Manager of the Hospital Authority. Dr. Lee will give a report on cases, and then Mr. Tony Wong will talk about the Leave Home Safe app, in particular the red and yellow code. Dr. Larry Lee first. Thank you. We have 1,565 patients in hospital, 230 are newly confirmed patients. As for patients in isolation facilities, 429 are in isolation ward, 75 in second-tier isolation ward, and 468 in the North Lantau Hospital, Hong Kong Infection Control Center. In total, 133 are newly confirmed patients. Yesterday, 7 patients reported to be in critical condition and 3 in serious condition. For the 7 critical patients, 2 did not have any vaccination record. The 3 had 2 jabs, 1 3 jabs, and 1 4 jabs. And then there are 26 critical patients and 21 serious patients in total. 9 are in ICU. And then for newly admitted cases, the number remains at a high level of 200. 23 are children under the age of 3. So we must appeal to parents again. You must take your children to get vaccinated for added protection. COVID-19 vaccination is the best way, most effective way to prevent deaths and serious conditions. And now the vaccination is open to babies of 6 months old, and then
接種第4劑疫苗嘅年齡亦都下降到50歲。
And then for those who are eligible for the 4th jab, please get vaccinated as soon as possible. The age has now been lowered to below 50. Now, for those infected with COVID, even if the symptoms are mild, they must seek medical attention as soon as possible, especially for the elderly and the chronically ill. If they see the doctors early, then they could get they could be prescribed with oral medication to prevent the worsening of the condition. Now, there are 4 death cases. There's a 3 male and 1 female, aged between 80 and 82. 1 of the deceased patient did not have any vaccination record. It was an 82-year-old male. He had hypertension, diabetes, and he had history of stroke. On the 18th of July, he was admitted to the Prince of Wales Hospital, and then X-ray showed that he had lung infection. And then he tested positive upon admission. CD value was below 20. And after he was admitted, he was prescribed with remdesivir and other anticoagulation medication. On the 25th of July, he was transferred to the North Lantau Hospital, Hong Kong Infection Control Center for continuous treatment, but then his condition slowly deteriorated. From the 26th of July, he needed concentrated oxygen, and then on the 11th of May at around 5 a.m. he passed away. For the other 3 deceased, there's a 81-year-old male. He had 3 jabs. He had hypertension, diabetes, and also history of stroke. And then he was admitted to the Port Hospital on the 4th of August because he had some sort of abscess on him. And then he tested negative upon admission by RIT, but then PCR test result was positive. CD value was above 30. And then he was administered to his antibiotic, and then his CD value remained above 30. So eventually he was transferred to general ward. But then he at about 6 a.m. on the 11th of August, he was found to have suffered shock, and then he passed away. And third deceased patient, 81-year-old female, who she had 2 jabs. She also had some sort of chronic disease, and then she was admitted by the North Lantau Hospital. Her kidney condition deteriorated, so she might have some urinary tract infection, and then she could possibly be infected case at a later stage, and then her condition started to deteriorate on the 8th of August, and she passed away on the 11th of August. The last deceased patient, 80-year-old male, he had 2 jabs. He had hypertension and history of cancer. On the 2nd of August, he was admitted to the Princess Margaret Hospital. Before that, he was in Princess Margaret Hospital for COVID and also pneumonia. And then he was discharged on the 29th of July after his PCR test result was negative, and then he was admitted to hospital again with because of shortness of breath and inadequate oxygen level in his blood, and then a lung X-ray showed some infection. CT value was about 20. He also had fibrillation, and then he was administered with some antibiotic and other drugs, but then he continued to suffer from shortness of breath, and there was low oxygen level in his blood, and his condition deteriorated on the 10th of August, and he passed away on the 11th of August. In the past day, 202 patients recovered, including 166 patients who were discharged. 7 patients tested positive upon admission. 30 patients and staff members in the same ward are listed as a close contact. There are 60 more members, staff members who became confirmed cases. 25 returned to work. And then there is also a cluster at the Castle Peak Hospital. The adult psychiatric ward, a nurse became a confirmed case on the 8th of August. The hospital immediately arranged the test for all patients and staff members for the same ward. And then in our press release between the 8th of 11th, there were 6 more confirmed patients. Today we found another 9 confirmed patients and 1 confirmed staff members. In total, there are 15 patients and 2 staff members who became infected. So the ward stopped accepting new cases, and there's some deep disinfection. And then 25 other patients in the same ward are listed as close contact, need to be quarantined. The hospital is now actively tracing the epidemiological lanes among the 17 confirmed cases. We'll also be taking samples from the ward for testing. We will closely monitor the health condition of the patients and the staff members. Thank you. Good afternoon. Yesterday, total number of new confirmed cases, 4,222 yesterday, and that included 1,263 RAT positive cases, 1,263 PLCR cases, and 2,959 RAT verified cases, and then 217 imported cases, and Dr. Lee reported 4 death cases. So in total, 9,346 death cases. Among the imported cases, 217 cases, 118 were found at the hospital, the airport. 95 cases were found within 7 days upon arrival. 27 cases were found after 7 days upon arrival, and 34 cases came from UK, 35 cases. USA 28 cases, Thailand 22 cases, India 21 cases, Philippines 20 cases, 14 cases each from Singapore and Australia. For the other 27 places, they have less than 10 cases. Homes, 7 residential care homes for the elderly and 5 residential care homes for the disabled involve the need to quarantine either residents or staff members. First, the Buddhist Punjab On, our residential care home for the elderly. Then second one, Lutheran Social Service Center, Lady Liang Hua Yi home for the elderly. There's a confirmed case, 8 residents need to be quarantined. And then Xin Yi Daiwa home for the elderly in Yao Chin Wong. 3 residents need to be quarantined, 1 resident's confirmed case. And in Ka Yi Taipo home, 1 resident's confirmed, and another 1 needs to be quarantined. And then in the Western District, Chun Tin home for the elderly, yesterday were 4 confirmed cases, and now today 2 confirmed cases involving staff members. So in total, 25 residents and 4 staff members need to be quarantined. And then Tin Long in Eastern District, 1 staff member is confirmed, and 17 residents need to be quarantined. And then Man Sao Kong in Shatin, 1 resident is infected, 5 residents and 1 staff member needs to be quarantined. And then Choi Yi Ji Ka and in Kwun Tong, 1 confirmed, 1 infected and 4 to be quarantined. And then in another home, there's also a similar case. And then in Chunwan, there's another home with 1 staff member infected and 3 residents need to be quarantined. And then in another home, 1 resident is confirmed and the rest needs to be quarantined. And then a rehabilitation hostel in Yunlong, 2 are infected, so 27 residents need to be quarantined. For schools, it's Friday today. There are 179 schools which reported 214 positive cases, including 147 students and 67 staff members. For the 213 cases, 42 from kindergarten, 70 from primary schools, 77 secondary schools, and 7 special schools. And 85 schools reported 2 or more cases in the past day. Today, though, schools need to suspend classes for a week. For variant strain, yesterday, there are about 14.9% suspected to be BA.4 or 5. For suspected BA 2.1, 2.1, 6.9%, so it's not much difference from previous figures. So that's all for my report today.
好，各位傳媒朋友。
Friends of the media, earlier the government has announced that the amber and red codes be added to the Leave Home Safe app for the infectious people. The audio has been monitoring the operation of these codes, and 30 billion comparisons have been made, and 20,000 or so change of code operation has taken place. Now, for some arrivals, their vaccine pass failed to change into yellow code. Now, when visitors arrive in Hong Kong, there is the testing procedure. They will have to be subject to quarantine in the hotels. Upon upgrading of the system, the visitors will be able to use the upgraded Leave Home Safe app, and their code will be changed to red or amber. Now, some said that they experienced difficulties when entering into the scheduled premises. Now, we are making arrangement for these to be upgraded, and the premises have also to upgrade the verification scanner so that they will be able to check the Leave Home Safe app code. If they have any questions, we have a hotline 2626-3066, 2626-3066. They're welcome to call through the hotline. Now, the yellow or red code holders will have to upgrade the Leave Home Safe app to version 3.4.0, and the premises will also have to upgrade the verification scanner to version 4.4.0. And they have to stay connected so that they will be able to check the QR code of the vaccine pass of the visitors. And according to the quarantine and other arrangements, the red code holders are not supposed to leave their premises. I'm going to use a PowerPoint to show you how the changes will be made. Now, upgrading the Leave Home Safe app is very simple. In the settings, all you need to do is to check the version. If it is 3.4.0, it is an update version. If it is not this version, you can go to the store to upgrade the app. For those that are coming from Taiwan and overseas, they are assigned a yellow code. Once the upgrading has taken place, and there will be direct comparison, and the color will be changed. And there is also a message to show that this is a yellow code holder, which is subject to medical surveillance. Now, once the medical surveillance is completed, i.e. day 7 at 9 a.m., the Leave 'em Safe app will remind them that the medical surveillance has been lifted, and the color will be changed. For the red code holder, the updated version will check whether this is a red code holder, and there will be a message to remind him that he is a person under isolation, and the vaccine pass will change into red in color, and the isolation period would be for 14 days. But if one fulfills certain criteria, like one has got 2 shots of vaccine, then on day 7, one can declare an RAT test showing that there have been 2 RAT negative results over the past 2 days. Once this has been done, then the color will be changed from red to yellow. Now, this is the site for self-declaration, www.evt.gov.hk. Now, all this information is sent out in the isolation order. We also have the hotline 2626-3066, 2626-3066. Any questions, you're welcome to call this hotline. Declaration is very simple. You go to the website, you choose the RAT negative result declaration. Once you're done with that, then you submit the information like the document number or the ID issue date. And there are also guidelines to take you through the steps for you to fill in the right information. Once this is done, then the system would have updated the information, and you'll be lifted from the red code, and the red code will be turned into a blue code. Once again, if there are any questions using the site or the Leave 'em Safe app, you're also welcome to call 2626-3066, and your questions will be addressed there. Thank you. It's now time for questions. Will you wait for the microphone, and please identify the organization you represent. Gentleman in white shirt, please. Cable News. Dr. Lee, an 82-year-old male, why was he transferred to the North Atlanta Hospital ICC? Why wasn't he kept at Prince of Wales Hospital? What was his condition? Now, for Leave 'em Safe app, they have the code turned from amber to blue, but they failed to gain entrance to the restaurants, and they have to update the vaccination record. If they encounter this kind of situation, will the scheduled premises allow these people in on the basis of the color? But the gentleman was admitted to Prince of Wales Hospital. Now, this is a usual practice. Upon admission to the hospital, we administered treatment. He was given remdesivir and other medication. The patient's condition became stable at the time. Now, all the vital signs and conditions have improved, and he was transferred to the North Atlanta Hospital ICC. Now, the ICC is a kind of hospital that can treat the illness. But from July 26th, the patient's conditions deteriorated, and on the 11th, he passed away.
Mr. Wong, Yes, we do note that for a handful of people, when they go into the scheduled premises, they may encounter each problem. So that's why we checked our system to make sure that the code will change to the correct color. Then the scheduled premises also update their QR code scanner as soon as possible, so they're able to accurately scan the QR codes of the customers. And then as long as people update to the latest version of the app, then the code will change to the right color automatically, and then these people could be admitted to scheduled premises. Thank you. The gentleman in a blue T-shirt. I'm from the Dot News. First question, some readers have told us that a confirmed patient uploaded the record on the 10th of August. It took over 30 hours before the code color changed. So how many such cases have you been made aware of? And then on day 6 and 7, if the RAT result is negative, does it mean that the code will change automatically to blue? Have you done any tests to make sure that the recovered patient's red code will change to the right color instead of saying red? And if there are such problems, would the people have to declare the cases first? And then Dr. Ho Pak Leung from the Hong Kong, you suggested that for asymptomatic patients be prescribed with the oral COVID medication. Do you have plans to do that? And what data do you have, clinical data do you have on the oral medication? Mr. Wong, now a red code. Now, if a person has updated the Leave Home Safe app and stays online, then after the system does the matching, then the code will change to the right color. For red code holder, under the isolation order, the person must stay in the relevant isolation place. So for those with a red code, say from day 7, of course, these people must have had 2 doses of vaccine, and then from day 7 for 2 consecutive days, they have negative RAT results. Then they could go to the website to make the declaration. If they do not make the declaration, then the isolation order will only be released on day 17, and automatically the system will change the code color from red to blue. And if they have any problems making declaration online, they can call our hotline 2626-3066, and our colleagues will give them assistance. Dr. Larry Lee, on the oral COVID medication, the hospital authority is following the international guidelines for patients with mild symptoms or with notable symptoms. We will prescribe the oral medication for those aged 60. Then we're talking about the critically ill and high-risk group, and for those age 60 above, we will prescribe the oral medication. For patients, we have to make an appeal. COVID symptoms could be really mild, so we would suggest people to seek medical attention at once. They could either go to designated clinics, or they could call 1-855-36115 or our HA Go app to ask for teleconsultation. Now, we have also advised our staff to step up their handling of the high-risk groups, in particular the elderly, or those who are unvaccinated. In making prescription, we'll follow fully our clinical guidelines and based on clinical assessment. The gentleman in a shirt. I'm from Now TV. Castle Peak Hospital. There are 9 more who've become confirmed cases. Are they in the same ward? And what is the layout of the beds? Why all of a sudden there are so many more cases? Do you know why? Now, a question for the GCIO. Now, for arrivals in Hong Kong, they may have taken all the steps you suggested, that they've updated the Leave Home Safe app. Then the premises also updated the scanner app But then even though the code has changed from yellow to blue, the person still could not get into the premises. So why is that case? Do you know the reason? Is it because the network is unstable, or are there other reasons causing the situation? For the Castle Peak Hospital cluster, previously we have 6 confirmed patients. They are in the same ward as the 9 new patients, but then in different cubicles, kind of. And we have checked that there is actually no possibility of cross-contamination or cross-infection. But then we don't have a full, a definite answer why it happened. We take this case very seriously. The hospital is now, having a meeting at this point. They are trying to see whether there are any links between the cases, or are they actually 2 separate clusters. So we will, be following up on the case. In response to your question, I don't have any information at hand for me to speculate as to what might have happened. But then I can stress that as long as travelers use the latest version of the Leave Home Safe app and they stay online, then the QR code color should change automatically. And then the premises must, of course, update the QR code scanner too. And then they must also, stay online before they could actually check the vaccine pass of the customers. Of course, if anyone has any questions, they could call our hotline 262-630-66, and then our colleagues will look at the individual circumstances to see what assistance can be offered. Thank you. The gentleman in the gray T-shirt. Can you please tell us your organization? I'm from Hong Kong 01. Question for Mr. Wong. Does your office have any information that there are cases of people with either the red code or yellow code? And then when they want to go into premises that needs a scanning of the code, then they encounter problems. And then for the 200 cases, in what case, can you tell us about their vaccination history? And then for the cases of new confirmed cases under the age of 3, can you tell us about the possible path of infection and also their vaccination history? Now, first, for premises, they must update their QR code scanner to the latest version as soon as possible. They must keep their device online. And as I have explained, for the updated QR code scanner, if you have you have a yellow or red code, but you only produce a paper-based vaccination record, and then your QR code actually hasn't changed color, then the scanner will be able to detect that, and then at the back end, the information will be noted and there'll be follow-up action. So I must appeal to those with a red code. If we want to reduce infection risk, so you must follow strictly the isolation requirement. You have to stay at the place of isolation. You can't go out. If they try to gain access to the scheduled premises, the updated scanner will be able to detect that. For new admission cases, 230 today, and we find that there is a gradual increase in the number of daily admission cases, and we are very much concerned about that. Now, 23 of the newly admitted patients are under the age of 3. At hand, I do not have any information on their vaccination history. But we are concerned about the total number of new admissions, in particular involving children. So we must appeal to the public again that vaccination is important. Parents, please do not hesitate. Please take your children to get vaccinated as soon as possible. As for the occupancy rate of our ICUs, it is about 50%. We don't see notable increase in percentage of serious cases, but then because there are more admissions, so we are really concerned. Well, let's take an English question.
Good afternoon. Some questions from RTHK. So how many people have the yellow or the red code at the moment? Do you have a number? And is the system running smoothly now? Did you receive any complaints or inquiries about the problems encountered? And if yes, what inquiries are they? And some people cannot enter the restaurants after their code changes to blue. So why is there this problem as well? Thank you.
Well, so far the system of the red and amber code is operating very smoothly, and our systems already detect over 30 billion times of code comparisons, and including 20,000 of code changes operations. So it's proved that the system is operating smoothly, and our hotline 2626-3066 is also available for citizens to inquire any question about the use of the Leave Home Safe mobile apps or the code change issues. So most of the questions can be addressed immediately. Most of the questions is talking about the duration of their code stated, and also some of the requirements about changing of the codes from ambers to blue or red to blue. So this is because the system or the scheme is still started for just about a week. So I think citizens need some time, or visitors need some time to get accustomed to these operations. So far as the system is operating smoothly. We did not receive problems about code. Usually is some inquiry about how to change it, and then on the spot our hotline already can address. And about your questions on some of the citizens, we also noticed that some of the citizens may have problems entering some venues that require scanning of the code. We already immediately assess and investigate our system to ensure that the code changes operation is operating normally and correctly, and to ensure that concerned people will receive the correct colored QR code in order to enter the venues. And also, I also want to appeal to venue operator. They must update their code scanning mobile apps to the latest version in order to ensure that this scanner app can correctly assess or investigate the customer's presented vaccine pass QR code in order to correctly access their code colors in order to allow them to enter the premises.
下一位，
And next, please. Lady in black at the far end, please. Orange News. About the red and amber codes, does the government have any information as of today? How many inquiries have you received, and how many issues involving the errors? And also the RAT negative test result declaration online. How would the government verify the veracity of the test results? Will you be spot checking? If there is any false reporting, what consequences would there be? And also the HA, the 81-year-old female, the CT value fluctuated wildly. Why is the case? If I may supplement a little bit here, our hotline has received inquiries about the usage, about the arrangement or the details regarding the red and amber codes. If one finds that there are problems with the color code of the QR code, if they have any problems, our hotline operators can address these questions straight away. Your other question is the verification scanner. The verification scanner has to be updated to make sure that they can check the QR code of the visitors. You mentioned the 81-year-old female. She was admitted to hospital through the Northern Hospital. Now, when she was admitted, her renal function was really poor. It's suspected to be a urinary tract infection. Her first test was negative. The second test the next day, positive, CT value is 37.8, and then negative, and the fourth day, CT value 35. Now, this situation, she was, her conditions were fluctuating between positive and negative. It is a pretty common occurrence, and when it comes to COVID-19 cases, this is a normal occurrence. That's a late phase recovery. Subsequently, for some reason, on August 11th, she passed away. We are convinced that her death has got nothing to do with COVID. Let's make it the last question. The lady over there. Mingpao Daily. Mr. Wong, you mentioned that people experience difficulties with the code change, and you updated the system to make sure that this happened smoothly. Now, what were the problems when it comes to the code change problem? How many inquiries, how many calls for assistance have you received at the audio? And the Education Bureau said that for the red code holders, if they want to go into the schools, the school should call the police. Now, will the authorities advise people to call the police if they encounter people with a red code trying to enter into premises? Now, for those who left quarantine hotels, how many positive cases have you picked up? And for the antivirals, do we have enough stock of antivirals? Now, for the COVID patients, some have minor symptoms that you advise them to seek medical attention earlier. Of what under circumstances would you prescribe antivirals? Tiredness, malaise, lack of appetite, no fever. Will you also prescribe the antivirals for these patients? Right. We haven't picked up any cases, positive cases, for those who have already left the hotel. Now, for day 6, 7, and 9, they will have to undergo testing. We expect that there might be some cases that we will pick up. Let me supplement a little bit here. There are some reports that some COVID patients are, or some people are experiencing difficulties entering into scheduled premises. Now, we have checked the system, and we have updated the system to make sure that people can enter the premises. If people have updated the Leave Home Safe app to the latest version, then there will be automatic comparison and conversion of the color code. And we also urge the premises to update the verification scanner to make sure that they will be able to check the status of the QR code. If people experience any difficulties, they're welcome to call the hotline. I can see that for the vast majority of the inquiries through the hotline, our operators can address the questions, and the QR code on the vaccine pass could be used. Now, for the antivirals, I mentioned 60 years of age. Now, for those about the 60 years of age, we do not look at the clinical history, and we would prescribe these to the high-risk people. We have prescribed 49,000 antivirals to the patients. 1,000 were prescribed by the private practitioners. We do have enough supplies to handle the situation. In terms of the symptoms, in terms of the background, there are many factors that the clinicians will have to look at. It would be hard, based on one single case, to say whether we should prescribe the antiviral, but we would follow all the guidelines and all the evidence. That brings us to the end of the press conference. Thank you very much. But for the Leave Home Safe app, it is not a registered system, so we don't know how many people have their code changed. We don't have the information with us.